Hello, and welcome to this week's episode of Giant's Healthy Innovators TV. I'm your host, I'm Barry Shrier, and I'm glad to welcome all of our viewers from around the world. Thank you, everyone, for dialing in. And as a reminder, if you like these videos, please remember to like them on our YouTube channel. And we also invite everybody to subscribe. So, Giant Health is an international community. We're nearly 335,000 people now. And our strapline is that we serve everybody whose business is healthcare, innovation, and technology. We invite all of our viewers to come to our website, www.giant.health. And also, if you're in the UK, we invite you to come to our annual event, the Giant Health Event, which this year is on the 4th and 5th of December in London. So hope to see you there. If you have any questions about the event or comments, or if you'd like to partner with us, please message us directly from our website. We work with a lot of the world's leading technology and healthcare innovation businesses, and we're very proud of the valuable partnerships that we have with them. One of our partners that we've been working with for years now is a business called iSensus. And today I'm very happy to introduce you to a member of the iSensus team, Dr. Heather Duncan. Hi, Heather. Hi, good afternoon. How are you?
Hi, Barry. I'm well, thank you. Good to be here.
Yeah, likewise. We're grateful for you taking the time to join us. So thank you very much. And we're looking forward to this conversation. Heather, if I could begin, please, by just asking you briefly to introduce yourself and also just to let our viewers know a little bit about iSensus.
Yeah, Barry, I'm a medical doctor by training, pediatric intensive care. And the area that I have concentrated on is monitoring and detection of deterioration. And that has taken me into the world of wearables and smart analytics, artificial intelligence. And so now I'm working with iSensus as their chief medical officer.
Excellent.
And really just trying to add in a bit of clinical expertise and guidance. Yeah.
Excellent. Thank you. And could you tell us, please, just a little bit about iSensus? Where is the business based and what are the main areas that iSensus is involved in?
iSensus started off in the UK, it's a UK-based country, but actually has offices across the world, Germany and India, and deployments across the world. And so our clinical deployments of wearable monitoring and the patient status engine are in the UK, in the United States, in Denmark, Switzerland, and then also across in India are the main deployments. But
Wow.
then there are other areas where we're exploring, which are low and middle income countries and other areas. Yeah.
Excellent. So the business is quite established, obviously, and active around the world, which is very, very interesting. Well, thanks for the introduction. So the theme we really wanted to explore today is the theme of optimization in healthcare. And I think a kind of core framework for this is, do we need incremental steps or do we actually need disruptive leaps within optimization? So let's just take a step back. A lot of our viewers will have a general understanding of this, but if we can start from the beginning, please. What does optimizing healthcare mean?
I think that healthcare across different environments has different demands and different expectations. But really, what we need to do is to optimize it for those environments and within those resources and health cultures. And so what we're really looking for is a healthcare system that has a high quality performance, that it is reliable and efficient. And obviously that's within the demands and constraints and resources of that particular environment.
Hmm. And I assume this is different in every country. Healthcare is very much a country-specific area, isn't it?
Yes, it is. Yes.
Hmm.
And so I've worked in a few countries with different healthcare systems, and they do have different aims and intentions with their healthcare systems. And so I think that that's really important. What does the healthcare system aim to achieve? And what part of the population, or is it the whole population that it's serving? And
Yes.
in what way is it serving the population?
Hmm. Hmm. No, that makes a lot of sense. Thank you for sharing that. Um, so we're talking about optimizing healthcare, what it means. What characteristics actually contribute to an ideally optimized healthcare system? What are kind of the bits of it?
I think that the most important thing is the intention. What are we hoping to achieve with this healthcare system? So this is taking a very broad helicopter view, and then we need to think about what are the pathways or processes,
Hmm.
and how do we achieve that, and how then do we know that we're achieving what we're hoping to achieve? And so if we have a starting point and a direction of travel where we want to be and some constraints about how we get there, that's going to help us to optimize a system.
Hmm. Okay, excellent. Um, so if we can kind of continue to drill down, I think it'd be really helpful for our viewers. So, for example, how does optimizing healthcare benefit? What are specifically the benefits for the providers, for patients, for payers, for each of these individual, what do you want to call it, key stakeholders in the healthcare world?
Yeah, I think that many of the healthcare systems are designed around the system, and the system is determining the desired outcome and the intended healthcare delivery.
Yes.
And so I think that we need to really turn that on its head. And actually, each of us, as healthcare users, actually, we should be determining what the healthcare system optimization looks like. What
Right.
does that look like? So I think it should be the patient or the patient's carer that determines actually what the healthcare delivers. And there are very few healthcare systems that can actually do that, where they actually would say to the patient, what is it that I can do for you today?
Yes.
Um, so there's a very interesting book which is can the patient will see you now,
Okay.
and which is really sort of turning around the whole system and medical top-down system, so the patient receives the care that they're offered, rather than the patient determines that the sort of healthcare that they require. So I think that that's the first thing we need to do is to really turn the systems on their head and to start with what does the patient really want? What is the best healthcare, and how can we best deliver the healthcare that this patient needs?
Yes. Yeah, so going back to the very original, if you will, topic, and the question, do we need incremental steps or disruptive leaps? Are you suggesting that in fact maybe we need more disruptive leaps than we do incremental steps? By your comment, well, we maybe should be, if you will, turning the system up on its head.
Yes, I think so. And so I think most of what we do in healthcare in terms of improvement, there's a lot of quality improvement in healthcare, both in process design and in outcome delivery.
Yes.
But we tend to be making small incremental steps. It's low risk,
Okay.
and we can actually make gradual, continuous improvements. But then we get to a point where actually we've made most of the improvements in the system that we can, and there's little more to be gained. And I think that when we want to make progress or when we want to really redesign, then I think that we need disruptive or transformative steps.
Yes.
And then we really need to stand back and say, what is it that we really want to achieve? And then work out how we want to do that, our direction and constraints, and then how are we going to maintain that change?
Yes. Yeah, exactly. No, this is very interesting. So you've made reference to the fact that historically, if I'm paraphrasing the points you're making correctly, let me know if I'm off target here. Historically, maybe healthcare is been quite systems led, and of course, historically. How do you say this? The clinician was kind of the king of the hill. They were, if you will, the authority. They were in charge. It was about the clinician's approach. You're suggesting that a transition towards concerning ourselves more from the patient's perspective
Yes.
it would be an improved approach. Um, and let's take that back to the question I mentioned before. In an optimized system, I guess what you're saying is obvious for the benefits of the patient. If the system is optimized from the patient's perspective, this takes us down the road of, I guess, often a phrase used is personalized medicine, isn't it?
Yes.
Um,
Yes.
But what would be the benefits for the clinician if we're making this transition, and if it's less, if you will, system-led and more patient-led?
So I think that as clinicians, we all want to do the right thing for the patient. So we have that common intent.
Sure.
And that's where we get our rewards in healthcare. That's why we do the job, is because we want to do the right thing for the patient. We want
Yes.
to reduce their suffering. And so I think that there are benefits for the clinician. It's just that we have grown up in a system which has been designed about, say, let's take a disease like heart failure, for example. And so we'll say, okay, so what sort of services do we need for heart failure patients? Let's design those services, and then let's invite the patients into those services and offer
Yes.
them. Rather than the disruptive thing, which is saying, okay, now in our population, we have 1,000 heart failure patients. Okay, now what services and care do those patients want? Some of those patients will be able to make quite high level requests about what sort of care they need.
Okay.
But we don't often ask them. And so we would ask the patients, what sort of care do you need? And then we would design the care around those patients. In the end, it'll end up being pretty similar, except for the fact that the patient has much more control over their appointments, their data, their choices. And so the control is with the patient, and we are a public service in healthcare.
Right.
Okay.
Yeah.
But it does mean that we need supports to be able to do that. So in this era where we have data platforms and artificial intelligence, actually now we're in a place where we can do this redesign, where we can work collaboratively with different companies who can do different parts of the electronic platforms, the data platforms, the
Yes.
interoperability, and then so that the patient and the clinician both have views of where the patient is in their journey, where we would like them to be,
Hmm.
and what needs to happen next.
Excellent. Yeah, that makes a lot of sense. I mean, it seems quite intuitive, doesn't it? It seems a lot more intuitive, in fact, than, how do you say it, where we are today. And so I don't know how we got to where we are today, but it certainly seems like there's plenty of room um, yeah, changing direction for the better. Clearly, for the better of patients. Clearly, as you've explained, for the better of the clinician. What about the payer? How would the optimizing healthcare, how would that benefit the payer?
So the payer is different in different healthcare economies, and so it might be a national based health service like the NHS. Other countries similarly have nationalized health services, or it might be private insurance based, or a combination of the two.
Okay,
The payer is always looking for cost effectiveness,
sure.
but probably more on the side of cost efficiency. Okay. And so, so I think that what we can use the artificial intelligence for and the data platforms for is to be able to better design and streamline the services, because actually there is quite a lot of waste in waiting for healthcare, cancelled appointments, and that might be, if you could do all of your healthcare investigations in one clinic visit in one day, or
Yes.
virtually, the patient logs on to the clinic in the morning and everybody comes to see the patient, and you get everything done in that day
Hmm.
as far as you possibly can, then that's going to be much more efficient. And so I think that it comes to efficiency
Hmm.
for both, but ultimately the payer is looking for cost efficiency,
Yes.
but at the same time, they are in healthcare, so it needs to be cost effectiveness.
Yes. That's interesting. And I know it's a bit of a cheesy phrase, but it could be a win-win-win, as they say, couldn't it? In other words, naturally, the payer is looking for these efficiencies, these economies, for things to be as cost-effective as possible. But of course, in a way, so is the patient, whether they're actually paying or not. I mean, the patient doesn't want to have to go to have a clinical visit and have to wait 90 minutes or something like that. I'm just making that up as a simplistic example. But there's a lot of the more efficient the system, the better for the patient as well, even from that efficiency perspective, which might not be the main thought of the patient. The patient's main
Yes,
thought, I'm presuming, is how do I get better?
yes,
Yeah.
absolutely. And I think that we all need healthcare advocates when we're negotiating the healthcare system.
Yes.
And so older people sometimes have a child who can actually help them through. I've worked in pediatrics for many years, and of course, I'm very used to parents as advocates and carers as advocates.
Yes.
And actually, they do get better healthcare if they've got an advocate or somebody who's actually managing their healthcare. Then making sure that everything happens at the right time, in the right place, in the right way,
Hmm.
is always better for the patient if they have a healthcare advocate. And
Hmm.
I think that we do have the opportunity for using smarter avatar-based healthcare management, healthcare managers,
Sure.
advocates.
Yes.
We should be able to enable our patients to say, actually, somebody's going to walk this journey with you and make sure that it's efficient. And I think that we are
That's a good point.
coming to that point where we would be able to do that, where we can actually have that as sort of assistance as well.
Yes. Yeah. No, that's a very interesting point, and that certainly points to a lot of opportunity in healthcare. So we've been talking about optimizing. We've been talking about the theme: what is optimizing itself? What is it in healthcare? How does that benefit the key, if you will, stakeholders, so to speak? I don't know if a patient wants to be referred to as a stakeholder, but they are nevertheless, alongside, of course, clinicians, providers, and payers. What about other industries? Are there examples? What is optimization? What are other industries doing in this theme of optimization? And are there examples of optimization, how it is approached in other industries, which could apply to healthcare also?
Yes, so I worked with Formula One software for a little while,
Oh,
the
wow.
Atlas telemetry. Yes, so it was the software that actually um, did all the analytics for the race cars, not the drivers,
Okay.
for the race cars, and we deployed that in intensive care. And the purpose for them is really optimization. So they
Right.
want to be the fastest so that they can win more money, and everything is surrounds the lap time. They have a measure of what is the fastest that they can do this lap and therefore win the race. And so that's the ultimate outcome. And they do all sorts of things to do that. They do lots of simulation. They do lots of purposeful practice. They do lots of redesign. They're not afraid to experiment and fail and
Oh,
to learn with gratitude that actually this design, even though we tested it in the wind tunnel, when we got it out there on the track, it just didn't work. And so now let's redesign.
right.
So I think we could do with a lot more simulation in healthcare to try and optimize processes before we actually use them for patients. And so I think there's that bit of design and that relentless simulation and practice until you
Hmm.
get it right.
Hmm. You often hear about the famous Silicon Valley software mantra, um, move fast and break things. And
Yes,
of course, often people say, well, you can't do that in healthcare. You don't try to move fast and break things when you are working with patients. But an awful lot of design, like you said, the metaphorical equivalent of air tunnel testing can be done
yes,
in healthcare, which doesn't put patients at risk. So there are lessons from other industries, aren't there?
there are. And so we're into the era of digital twins now, where actually we can produce digital twins and then we can do the simulation on those digital twins. And
Right,
so we'll have a patient simulator, as it were, or a simulated patient or group of patients or spectrum of patients.
right.
And then we can actually do offline simulations in order to optimize. And then we can find the most streamlined pathway, and we can also understand when things are not streamlined, and when we don't have laminar flow, and when we do get disruptions.
Yes.
And so we can start to learn a little bit more from gaming, for example, where, the avatars in gaming are very useful in terms of helping us to identify health-seeking behavior. I think they used it quite a lot in the flu epidemics and in COVID, they used that.
Yes. Yeah.
And so I think that avatars or digital twins are going to enable us to be able to experiment and optimize with purposeful practice in order to get it right
Yes.
before we actually even have patients within the stream of care.
That's fascinating. Absolutely fascinating. The theme of digital twins, uh, which leads us to the next topic within optimizing healthcare in particular. How is it measured? How do you know you are optimizing? What are ways of measuring, and how are those applied?
So each small part of the healthcare system will obviously have its own aims and intentions, and it can get very complex in
Okay.
terms of, so if we have our heart failure patients, we can say that we want them to be at work and contributing economically or living their best life, having their best quality of life. And so we could have quality or health-related outcomes, or patient-related outcomes, whatever they would choose, or we could have economic outcomes.
Right.
And so basically we're going to choose what those outcomes are going to be. But I would like to think that we could consider something different, like joy or happiness. Okay.
Wow.
And so, really, healthcare, our main intention is to reduce suffering. Okay, that's as doctors, healers, for thousands of years, that's been our intention, is to reduce suffering. It's quite a negative approach, isn't it? I mean, it's the right thing to do for healers, but
Yes.
actually, in a healthcare system, should we be looking at something more positive, which is, should we be looking at happiness? There are countries that have gross national product measured as happiness. Then now
Yes.
the IATI has developed really good measures of joy in work,
Hmm.
joy and happiness. And so I think that I would say that, we do have lots of outcomes about efficiency. Are we doing the right thing in the most efficient way, both cost and time wise? But actually, if we are turning the system on its head and saying to the patient, what would you like to achieve? Well, we'll probably go back to the ancient Chinese, where they used to pay their doctor to keep them well. And when they were not well, they stopped paying their doctor. Okay.
Wow.
So,
Yeah.
so
Yes.
we pay our doctors um, when we're sick.
When we're
Um,
unwell. Yes.
rather than when we're well. And so
That's
I think
extremely.
that we really need to be a little bit more creative in terms of our overall aims with this. Um, uh, it could be happiness, it could be joy, it could be, did this process go right for you? Did it meet your expectations?
Hmm. Hmm.
And so, because they're very composite, those outcomes. And we'd have to, like the lap time in Formula One, like there are like hundreds of different outcomes that will
Yes.
underlie that single outcome. But actually, all of them feed into, did we do the right thing for this patient in the right time and in the most efficient and reliable way?
Yes. Yeah, it is extremely complex, isn't it? I haven't heard that topic that you mentioned. That am I correct? Did I hear you correctly? That in ancient China, um, you would pay a doctor when you were well, not
Yes.
and stop paying them when you were sick.
Yes.
That's absolutely fascinating. Let me talk to my GP about that, and I'll let you
Yeah.
know their response. But
Yeah.
no, pardon me for being cheeky, but that is so interesting because we are in a necessary transition from the current system, which of course is called healthcare, but which we understand is sick care.
It
Um,
is.
you only call your GP or go to the hospital or dial 911, of course, when you're unwell. And that's not scalable in this country or, to the best of my understanding, in any healthcare system anywhere in the world. So all of this comes back to the patient, the opportunity to encourage the patient to concern themselves with their own
Yes.
wellness. And maybe I shouldn't have pizza and beer 7 nights a week. I don't know, but I guess there is something in that. And so this transition to wellness and to concerning ourselves with health, and like you said, even larger, if you will, more holistic manifestations of that
Yes.
happiness and joy, which clearly are long-term big goals, aren't they? So that's very interesting. But my gosh, it is complicated. I like the Formula One analogies, and of course, it's so interesting and important to say, well, what are other industries doing? And what is the application? And there are lots of applications, aren't there,
There are.
directly from other industries, which maybe have more money to dabble in things which isn't necessarily available in healthcare. So
Yeah.
that's extremely interesting. Thank you for sharing that. I also just wanted to explore a little bit more about, you were talking about the complexities, the measurement, the hundreds, if not thousands, of data points. So what role does data analytics itself play in optimizing systems? Are we using that? Is that a central element here?
I think that data analytics, once we find the pathway that's optimal for the patient journey,
Right.
then and I think that, yeah, so once the healthcare system and the patient determine what is the optimal pathway for this patient,
Yes.
then I think that we can tag the data points along there. And so we can describe work as imagined, what we would like the pathway to be.
Okay.
And then when we can start to measure the deviation from that. So that's work that so that's actually the pathway that actually happens. And we know that there's a gap there.
Yes.
But if we start to measure that gap from the ideal to the actual, then we'll start to understand how we can actually reduce that variation and actually tweak that patient journey at the individual level, but also at the population level. We can start to tweak that towards the ideal. Okay, so we're not looking for when do we fail. We're looking for how do we succeed, and what does success look like, and how do I get closer to success? And each part of the patient journey, we can actually then measure and aim to reduce that gap to
Right.
get it to the optimal journey, really.
Yes. Oh, that's very interesting. Um, so the analysis of the data um, is giving you what, like a feedback loop,
Yes.
which informs you if you are going down in the right direction regarding the pathway, which fundamentally should be informed by the patient to start with, rather than the system.
Yes, yes. And for many of the patient pathways, it is fairly linear. Okay.
Of course.
For some patient pathways, we do go through sort of an iterative circle. But then it's important to really acknowledge that we are in this iterative process. We're in this test and trial and establishing what is the right pathway. So we're in
Right.
this sort of iterative pathway, circular pathway, as it were. And then before we can actually find the right journey out. And so they will need different analytics to make sure that we're doing efficient testing in the iterative cycle, to the analytics of just trying to optimize on a linear journey.
Yeah.
But data analytics will tag the process all the way along,
Hmm.
both in terms of time and was the correct information available to everybody at the right time. Were the decisions made in a timely way? Was the treatment delivered in a timely way?
Yes.
And did we achieve our outcomes? And so it's really what we're going to be using analytics for is really putting actionable intelligence in front of the decision makers. And I mean patients and healthcare workers being the decision makers. And
Yes.
so we want the data to be measured, but then to be converted into something that can help us to do something to benefit the patient. So actionable intelligence is what we're looking for.
Yes. Yeah. Actionable intelligence. Yeah, no, perfect. Could you give us some examples regarding iSansus and your involvement, iSansus's involvement in what we've been talking about today? It'd be great to help our viewers who are from around the world, and a lot of them, of course, are directly in healthcare, but some of them might not be aware of iSansus. So I'd love to hear a little bit more about how you guys are, where you exist in this ecosystem, and
Yes,
the work that you guys are doing.
yes. So in one of the big deployments of wearable monitoring that we did in Children's Hospital in Birmingham,
Okay.
we monitored children with wireless monitoring, and that monitoring came out of so had two little sensors connected to patients. And then wirelessly, the data was transferred to a gateway and then into a dashboard that we could then see. And so for the patients, far preferred the wireless monitoring, okay, because I don't know if you've ever had your blood pressure measured overnight or whether you've been in hospital overnight on wired monitoring. It's almost impossible to sleep.
That's right.
It's really difficult to heal while you can't move around or sleep, and
Yes.
monitoring in
Absolutely.
hospital in general doesn't allow that. So, but also for children, they want to be cuddled, up and about, moving. They want to, go to the playroom. They want to play with their PlayStation. They actually do want to be free. So it was their choice was to have wearable and wireless monitoring.
Okay.
They also wanted people to be able to see that monitoring at the bedside and remotely.
Hmm.
And they wanted us to be able to do that in a smart way. So we would do that in an early warning score. So the data would go into an early warning score and visualization so that we could see when they were deviating from normal.
Right.
But then also we had some smart analytics with a rapid index. And so we were actually using a measure of surprise so that we could actually tell when they were deteriorating. And so we were reducing the number of real-time alarms that are so noisy in our current monitoring in hospital.
Yes.
And by having a slower but more accurate measure of deterioration. And so that would be then using all of this data to look at when the patient was deviating from normal, and then would be able to alert us as clinicians
Excellent.
as a recommending system to say, please, would you review this patient because their physiology is deviating from what we would expect for
Right.
them. Okay, so it's very personalized. It's for them. So it learns them and their physiology and then alerts us based on that. So we can do that in hospital where we did it. We can also do it at home.
Yes.
And so we can have, and they would prefer to have their monitoring at home. So our patients definitely, they want monitoring that's comfortable and wearable, but they want to have it in their own environment. These children will tell us very clearly they do not want to disrupt the school run. They
Yep.
do not want the parents to be off work.
Yes.
They want their social lives to be arranged so that they can still get healthcare, but not compromising their family socioeconomic systems.
Yes. And all
Um,
that makes sense, doesn't it?
yeah.
Yeah.
So that's so we could use that data to determine patients where they were when they were deteriorating, but also when they're getting better.
Hmm.
And so and try and get them home sooner when they are in hospital.
Brilliant.
So that's how we can use this data. We can also monitor at home to say, yes, go home early from surgery, for example,
Right.
and actually, start your rehab at home, because we're going to do much better rehab at home, I think,
Well,
often.
absolutely. Yes.
So go home, start your rehab, and we will do a ward round with you every day at home. and then we'll see you in 72 hours, a week's time.
Right.
And so, and then, but all the time, you can see your data, we can see your data, and both of us can actually then generate an interaction, or ask questions or request a review, whether that's virtually or in person.
Excellent. That's an absolutely outstanding service, and it's such an amazing, important innovation. And we know, as we were talking about earlier, that this requirement to move from sick care to wellness, so to speak, is itself quite powerfully enhanced by getting patients out of hospital and back home,
Yes,
isn't it? And
yes,
um, patients are mentally more well off at home than in hospital, and that
yes,
itself has a contribution to their physical recuperation, doesn't it? So
yes.
there's a lot of factors here, and that's such an incredibly impressive arrangement and accomplishment that iSensus has developed. So good to hear about it, and congratulations.
Thank you, Barry. I guess that what I do need to say is that each of us, each company, in this arena has an area of expertise, and no single company is going to be able to have the expertise to do it on their own.
No,
And so it does need collaboration,
yes,
and it does need sort of really careful work on interfaces to really get this right. But I do believe that we're at the adjacent possible of having amazing healthcare.
yes, yeah, no, absolutely. Well, look, thank you so much for sharing your story. Really, really appreciate it. And I hope that you guys are going to continue with the impressive innovation and accomplishments, and also the impressive, if you will, implementation around the world. So I'm so sorry, but we have run out of time. But what we'd like to do is we'd like to invite you guys to come back and to give us an update. Maybe, for example, 6 months from now or something like that, we could do another recording episode like this. And we'd love to continue following your impressive progress, your successes around the world. Maybe we could hear more about specific case studies and examples, like the Birmingham program that you talked about, because this is really valuable stuff. And we love to continue championing and collaborating with you guys. So, Heather, thank you so much for your time. Really appreciate it.
You're welcome. Thank you, Barry.
No, we're grateful for your time, and we're grateful for you sharing all the important and valuable and quite insightful information which you've given to us today. So thanks again for that. Um, we obviously want to announce to all of our viewers from around the world that, of course, we have this valuable partnership with iSensus, and we love working with you guys. And we'll be able to see you at the Giant Health event in December in London, England. So for all of our viewers, again, the Giant Health event is on the 4th and 5th of December in London, England. You can learn more about that at our website, www.giant.health. We also will put the links to iSensus at the bottom of our video on our YouTube channel and on our website. And Heather, once again, thank you. This has been an extremely interesting and informative, and for me personally, a very uplifting conversation. So thank you for sharing. We appreciate that.
Okay. Thank you, Barry. I look forward to seeing you at Giant Health. All
Yep,
right. Okay.
likewise.
All right.
So thanks to Dr. Heather Duncan. Thank you to our partner, iSensus. And once again, we appreciate all of our viewers from around the world. We invite all you to contact us if you have questions, if you have comments, if you'd like to meet the people from iSensus, please message us directly. And so that's the end of this week's episode. This is Giant's Healthy Innovators TV. I've been your host, Barry Shrier, and I hope you found this interesting and informative. As a reminder, if you like these videos, please like them on our YouTube channel and subscribe. That helps us to help you. And we hope you've enjoyed this episode. Thank you very much.